Hello, everyone, and thank you for joining this webinar. My name is Sharon, and I'm a youth advocate and part of the youth advisor in the MHPSS Collaborative. I'm going to hand over to Victor to introduce himself.
Thanks a lot, Sharon. Hello and welcome to today's webinar launch. I'm Victor Ugo. I'm the Mental Health and Youth Advisor at the Collaborative. I'm very happy to see you all today. Over to you, Sharon.
Okay, thank you, Victor. And thank you to everyone for joining us today for the launch of this exciting new resource on integrating youth leadership into mental health and psychosocial support responses in humanitarian emergencies. This comes out as an outcome from the collaboration between the MHPSS Collaborative and master's students from the Geneva Graduate Institute. Two things to note before we begin. The first one, this webinar will be recorded and shared on our website and social media channels. The second one, if you have any questions, please feel free to put them in the chat and we will try to get them at the end. Now, we're going to take a look at the agenda for today. First one, we will have a roundtable discussion with some of the researchers, Eric and Shruti, followed by a presentation from Dr. Isaac Olufadewa, who will share practical experiences on youth leadership in the context of his work with the Slum and Rural Health Initiative Network. And then we will have some time for questions at the end. So let's just jump right into it. I'm pleased to invite the researchers, Shruti Lal and Eric Dagadu, for the roundtable discussion on the resources being launched today. Shruti is a master's candidate in anthropology and sociology at the Geneva Graduate Institute. She recently completed her first master's in international relations and development studies with a specialization in the migration regime. Her prior research lies at the intersection of culture, decolonial action, and mobility, and she is currently researching critical development within Christian missionary environments in the context of India. And then we have Eric. Eric is a development practitioner with over a decade of experience dedicated to advancing capacity development and support of good governance, peace, and security across Africa. Paul Klahre, one of the researchers, unfortunately cannot be with us today, but luckily we can hear him share some information about the research in a video. So let's check out the video.
Hello and welcome. In humanitarian settings, the role of mental health and psychosocial support response is not only important as ever since, but rightfully so increasingly recognized. In its planning and implementation, however, one group has long been left out of the picture, until today, young people and the potential of their leadership across the globe. In partnership with the MHPSS Collaborative, this applied research project has developed guidelines for the new Youth Humanitarian MHPSS Nexus, entitled Integrating Youth Leadership in MHPSS Responses in Humanitarian Emergencies. We are particularly proud that young people have been involved in this research project from its onset and helped shape the final outcome. See for yourselves.
Young people are vital for improving relevance, scope, and resources for MHPSS responses by better understanding community needs, offering innovative solutions, extending outreach via peer support, advocating for mental health, and also by enhancing overall capacity.
Working with young people in mental health and psychosocial support responses is not simple, but not due to the lack of their potentials. On the contrary, their skills are very often underestimated, their perspectives are overlooked, and they are not trusted due to harmful stereotypes. Youth organizations cannot access funds, and humanitarian organizations lack the capacity and the expertise to cooperate with youth. This research project creates a bridge between demand and supply by creating a practical, hands-on guidance on how to cooperate and work with young people in MHPSS response.
In the development process of the guidelines, we try to be as collaborative as possible. Hear another voice.
I was excited to actively participate in a focus group where we discussed our experiences and involvement in MHPSS. I later had the opportunity to provide comments on the findings and on an initial first draft of the guidelines. To be engaged throughout the research process has been a rewarding experience.
The finalized guidelines contain an introductory section with a short purpose statement, the target audience, a short description of the development process, the key definitions, and a concise summary. At its core,
first, we talked about the importance of youth leadership. Then we went through some of the barriers and challenges in the way. Then we talked about the ways on how we can create and establish meaningful partnerships with the youth. And finally, we laid out some strategies in order to promote and integrate youth activism into MHPSS response.
A special edition is a self-assessment scale for youth leadership that organizations can use in their own work.
Okay, now we will hand over to Shruti and Eric.
All right. Can you hear me? Yeah. Thank you very much, Sharon, and for the opportunity, and good afternoon, or good morning, or good evening to all participants, depending on where you're calling from or joining us from. Let me start by stating that my colleagues and I are very happy that today actually marks the culmination of many months of effort in producing these research documents. And we are also super excited to have been part of this project. And of course, thanks for the opportunity to work with the MHPSS Collaborative, Victor and his team at the Save the Children. And for us, what is important is that, these resources would achieve their intended purpose, that is addressing the needs of young people and organizations involved in delivering MHPSS responses and services in humanitarian emergencies. My colleague Paul should have been part of this meeting, but unfortunately, like you mentioned, Sharon, he's also attending to an equally important commitment somewhere. So in this segment, Shruti and I will be sharing some key highlights of the research and also speak a little bit about the resource documents that were developed from the research. And so our discussion will basically focus on the rationale for the research, why did we conduct this research in the first place? And then we'll also talk about some key findings of the research. And then we'll also discuss the core principles, some of the core principles in the research. And then also look at the Youth Leadership Assessment Scale, which was also one of the key documents that was developed, which basically provides some framework, by which organizations can hold themselves, accountable on the extent to which they are, involving young people in MHPSS, and also why it is important for these organizations to do so. So that will basically be the focus of our discussion, and I hope we'll be able to make good of the time to be able to go through all of these, yeah. So I will start, by talking about the rationale for the research. I mean, for us as researchers, I think that we had to conduct this research because we needed to graduate from our master's program. That's on the lighter note. Yeah, of course, it was part of an academic requirement, and so it was actually a collaborative effort between the MHPSS Collaborative and the Graduate Institute as part of its applied research project. But on a more serious note, I think that the research itself was a response, to the recognition that young people are really making a real difference as leaders in humanitarian responses. And more people are beginning to see how important, their contributions are, especially when we focus on issues of mental health, community involvement, support during humanitarian crisis, etc. But, involving young people as leaders in mental health and psychosocial support, it's still something that, hasn't been explored much. And many organizations who are working in this space, I think have a chance, to make their responses better and even more effective by tapping, into the energy and ideas of young people. The problem, however, is that many don't fully see how important, this is. Of course, because many organizations still have their own doubts about the capabilities of young people, which is often rooted in negative stereotypes, or those who still feel that, there's the need to do that, don't also know how to go about it. So the whole idea was to create a guidance document that will encourage organizations, who have doubts about the capabilities of young people, and at the same time also assist, humanitarian organizations who want to engage young people but don't know how to go about it. So the idea was to create some guidance documents that will encourage them but also assist them in effectively incorporating, youth leadership into MHPSS responses. And I'm very excited that today we have managed, to produce these resources that will go a long way to address these challenges. I want to touch a little bit on the methodology, which I think is very important to note. In terms of the methodology, I would say that the entire process was youth-driven. And that is to say that the focus group discussions we had, the interviews and etc. were mostly with the young people, across the world. I'm sure some are even joining on this webinar, who are working in various humanitarian emergencies. So it was really their lived experiences on the field that's mostly fed into the research. And the key highlight, for the whole process was also the co-creation workshop, which we had with these young people, that culminated in the production of the guidance document and the youth leadership assessment scale. So to conclude this part, I will say that these documents, have not been produced out of vacuum, but they are actually based on very substantive, feedback, very solid recommendations that we receive from young people working on the field. All right, so with this, I would hand over to Shruti, my colleague, who will share a bit on the key findings and highlights on some of the issues that we discovered. Thank you very much. Shruti.
Thank you, Eric. But feel free to jump in if you, whenever you see relevant. So hi, everyone. I'm Shruti Lal. Good afternoon from Geneva. Like Eric mentioned, this was a project that spanned over many months, and we're finally getting to the very last bit of it. And throughout the months of working on this project, this research, we were able to see a clear shift in paradigm from the narrative of young people seen as simply as beneficiaries of MHPSS responses to active contributors. And this is when we realized the need to produce a document or some guidance to answer our question of how can we effectively or meaningfully integrate youth leadership into MHPSS responses within humanitarian emergencies. And we recognized its importance during the course of our research, our literature review, and even when we spoke to numerous participants during the interviews and the focus group discussions as well. So I'm going to briefly get you through two things right now: the importance and the barriers or the challenges that young people faced in integrating their leadership into MHPSS responses. So while youth leadership is transformative in the field of MHPSS, bringing unprecedented value in many, many dimensions, we recognize mainly the importance of enhancing the relevance of MHPSS responses when young people are involved. We were able to recognize that young people possess a deep understanding of our own needs. I would say our own needs, because I do believe I fall under the, all of us in fact fall under the category of young people over here. So let's change that, be reflective a little bit. So we do possess a deep understanding of our own needs, the strengths and needed within our own communities. And this unique perspective enables us to inform relevant, suitable, effective interventions within organizations, no matter how big or how small they are. And our innovative ideas, our creative solutions, our technological proficiencies, it helps to modernize MHPSS responses and ensures that it is adaptable to the changing nature of dynamic environments, because emergency situations are constantly changing. We can see it happening in the world today, one crisis after the other, and young people are crucial in this ever-changing dynamic of emergency situations. The second point is that we have an expanding reach. Young people have an expanding reach within emergency situations. Our efforts significantly broaden the scope of responses as we are well positioned to engage with our peers, strengthen peer-to-peer support networks, foster open conversations about mental health, and we have an ability to break down social stigmas that surround the conversations of mental health, and we are in a position to amplify the impact of interventions within our own communities, and not just within our own communities, but even beyond. The third point is that it's important to involve us to boost the capacity of MHPSS responses. This is because our energies, our motivation, our enthusiasm to be mobilized very quickly in emergency situations can contribute to the scalability of responses. And during our focus group discussions, participants did confirm that the young people are able to provide low intensity solutions when there is a lack of professionals during emergencies due to the nature of emergencies or due to the sheer demand of such services as well. And the last main point that we were able to recognize with respect to the importance of youth leadership is that it directly benefits young people. So engaging young people in MHPSS responses, it doesn't just empower them as leaders, but it also fosters self-reflection to our own mental health, and it recognizes we are in a position to recognize our own agency and decision-making skills, and it provides us with opportunities for developing our career, enhances our soft skills, and it does elevate our status as valued partners in our field and in our communities as well. And our research brought out the learning processes young people go through when they are involved in MHPSS responses, which helps them to build a more conscious self, so that when they are older, they're able to think better about mental health issues. Not to think better, but think about these issues in a more mature way. And with these, it seems like you've got a recipe for success, but for inclusion of youth leadership. But to cut off the burnt edges, we did recognize we were confronted with a lot of barriers and challenges that both organizations and young people face within environments. Several key barriers were talked about, and the first one is that there is a mutual lack of trust on the part of organizations and on the part of young leaders as well. Organizations mistrust young leaders because they think we are not capable enough, we are too young, we don't have enough experience, and on the flip side, young people do not trust organizations due to tokenistic representations or insufficient representation. When it comes to collaborative challenges, organizations may lack resources or fail to even appreciate the diverse experiences or perspectives of young people, and this can lead to ineffective collaboration. And a third barrier that we were confronted with was the exclusion from decision-making. The young people were frequently excluded from meaningful decision-making processes, and when involved, they felt that their participation was merely tokenistic. In fact, one of the participants mentioned that when youth were involved, it was merely to give their thoughts on something that had already been planned and prepared by the elders of their community. But these are not, it's not the end of the world. These are problems, challenges that can be mitigated as a group, not just from the perspective of the organization. Get young people involved. How can we do this? These gaps can be bridged by open dialogue, creating dedicated roles for youth engagement, establishing youth advisory bodies, advocating for policies that prioritize authentic youth involvement in decision-making processes as well. And further challenges that we faced were made aware of were the limited resources faced both by young people and organizations This involved constraints that hindered their both contributions to MHPSS responses. How can we work around this? Dedicated funding streams, traineeships, mentorships, connections to many relevant networks that can empower young people and strengthen their impact within their communities. Number five was the risk of harm that we were made aware of. Young people often face burnouts in situations of emergencies, or there can be an inadvertent reinforcement of existing power imbalances or social hierarchies of whatever of the communities that you are embedded in. So prioritizing their well-being, conducting regular check-ins, setting clear boundaries, fostering safe environments so that young people continue to be able to provide the best of their abilities to mental health responses is protected. In fact, one of the participants mentioned, and I quote, this was when they realized that when they were given enough self-care, and I quote, I felt like that was one of those first moments where I actually felt like I was not only taking care of others, but I was also being taken care of. And this, it's a testament to young people being strong and capable, highly efficient in their own right, but that doesn't make us superheroes. We also need to be taken care of to take care of other people. And this is so that we can reduce the risk to ourselves and we can serve our communities better. And the last challenge that we spoke about was overlooking diversity of young people. We're not all the same. We're not a monolith. We've got our intersectional subjectivities that we carry within the communities that we work with, and treating us by disregarding our unique experiences or identities, our needs, our cultural heritages, it proves ineffective. Organizations ought to actively recognize these distinctions, amplify our marginalized voices, address inherent biases on the part of the organization and the communities as well, so that a truly inclusive engagement can be fostered. One of the participants mentioned, and I quote, "You have to dig deep and go local, more local to reach different groups of young people." And these just cover a few areas of importances for including young youth leadership into MHPSS responses. And while we know of its importance, of course, every journey has its own barriers and challenges. And I think challenges are just a way for us to reevaluate how badly we want this to work. And I'm sure everyone here, we are quite desperate to have young people's leadership to the best of our abilities. So I hope this is not an end. It's just an obstacle that we've got to overcome for the next step. Eric, if you would like to add something, feel free.
I thank you, Shruti. I think I was going to talk about the diversity issue, but I'm very happy you actually raised it. And so, I mean, because of time, I think that we can move on to the next point, which is talking about the principles and also some of the strategies that organizations can employ in integrating youth leadership into the MHPSS responses. So what we are effectively saying is that, for organizations to be able to partner with young people in MHPSS responses, they must adopt some guiding principles that, prioritize meaningful engagement, collaboration, and empowerment. And so the guidance documents that we actually produce give some, principles. Actually, there are about 6 of them. And I'm just going to read them as they are for the sake of time. The first principle is that organizations must foster their commitment into youth leadership. or they should approach youth partnership with thoughtful planning and realistic expectations. That's the first one. The second one is that organizations must recognize and value young people's unique needs, perspectives, and experiences. That is where the issue of diversity comes in. And then young people should be treated as equal partners, not just beneficiaries in MHPSS responses. And the fourth one is organizations should strive to equitably engage all young people, particularly those from marginalized or underrepresented groups. Yeah. And then young people should also have the agency to shape and lead MHPSS initiatives. And then organizations should strive to make youth engagement a long-term sustainable practice. So if you look at the guidance document, it also gives some recommendations on each of these principles, as to how they can be achieved. For example, if you take the principle on young people should be treated as young partners, not just beneficiaries in MHPSS responses, the guidance document gives some suggestions as to how it can be achieved. So, for example, it says that organizations could, empower young people to lead initiatives just beyond data collection, but they can include them in their program design, implementation, and also evaluation. And then organizations can also demonstrate their respect and also value the perspective of young people as equal contributors to decision-making, and not just only engage in tokenism, where they just engage them for engaging's sake without necessarily taking on board their views and perspectives. So these are just a few examples. I encourage you to refer to the guidance document. And then I'll also speak a little bit about the strategies. And we think that now, to be able to transform these principles into action, there has to be some concrete strategies. So the guidance document also outlined some 9 strategies that that can be adopted to effectively, integrate youth leadership into MHPSS responses. And again, for the sake of time, I will just mention the strategies. The first one is foster organizational commitment, which means the organization should try to embed youth leadership within the organizational DNA. And then they should also invest in training and mentorship, that is, empower young people with the skills and knowledge they need to lead. And then they should also prioritize youth safety and well-being, that is, create a supportive and protective environment for young leaders. They should also integrate youth into decision-making, that is, create a seat for the youth at the decision-making table. They should also collaborate or partner with youth organizations. They should endeavor to secure long-term funding for youth-led initiatives. They should recognize and compensate the contributions of young people, which is very important. And then they should also encourage feedback and continuous improvements. So again, I refer you to the guidance document, which provides some more details. So these are some of the principles and also the concrete actions or strategies that organizations can employ to effectively engage the young people, but also integrate them into their MHPSS responses. I will talk a little bit about the Youth Leadership Assessment Scale, which I think it's also very important for us to highlight. And as I mentioned, the MHPSS Youth Leadership Assessment Scale is like a simple tool to help organizations, assess the level at which, they are involving young people, as leaders in their MHPSS responses during humanitarian crisis. And so it has actually been designed to guide organizations in reflecting on what is working and also where there are areas of improvement they take remedial action. Now, the question one will ask is, so what's the importance of actors working within this space, to hold themselves accountable? Because that is what the Youth Leadership Assessment Scale, seeks to do. Hold organizations accountable to the extent, at the extent to which they are involving young people in their MHPSS responses. And I would give the reasons, for which organizations should do that based on the responses that, you know, the young people themselves gave when we engage. And I think that Shruti has given some of the reasons in terms of the benefit that, you know, these organizations stand to derive if they tend to hold themselves accountable at the extent to which they are holding or they are involving young people in their MHPSS responses. And one of the reasons that I noted is the fact that, you know, young people bring a lot of unique energy and fresh ideas because, of course, they are deeply connected to the challenges, you know, in their own communities, and so they are able to identify themselves with those challenges. And I feel that when they play those leadership roles, the solutions they tend to offer tend to be more innovative and also effective. The second reason, which in terms of benefits, is the fact that, you know, when we empower young people to lead, we are also preparing them for the future, because they are the ones who will carry this work forward, you know, when they are adults and no more. And so I think that, you know, for the future sustainability of this project and the impact, I think that's important that they are also engaged. And honestly, when we include these young people, I think that their outcomes are also much better, because they usually tend to challenge, you know, old ways of thinking, and then they push people to approach things differently, which is exactly what we need for a societal transformation. And I think that it's also very fair, you know, to include them, because, you know, often young people are only included as an afterthought, you know, as Shruti mentioned. I mean, the decisions are already taken, the programs are already developed before they are consulted. But I think that it's important that we give them real leadership roles. And then once we do that, we are also saying that your input matters, and that creates some level of trust and also builds strong connections. And again, when young people feel that they have a real stake in what is happening, they are even more committed, you know, to the project. So I think that it actually inures to the benefit of the organizations to do so. And last but not least, I think that you know, young people are often ahead of the curve in terms of technology, new ideas, etc., and which I think can really help organizations stay on top of changes in the world. So making space for them within the leadership space, I think that is just helping them to grow. And it's also about making the efforts of the organizations more strong. I mean, the efforts of the organization stronger and more sustainable in the long run. So in the end, it's a win-win affair. The organizations themselves are winning, but also the youth themselves are winning in terms of building their capacity, you know, for the future. So, I mean, these are some of the reasons that I think that organizations must hold themselves accountable and must be committed, you know, to integrating young people into their MHPSS responses. I don't know if Shruti has something else to add to this.
I think, well, thanks, Eric. I think you've covered everything, but just bouncing off the guidance document that you mentioned, I think for the participants, it's also important to know that we didn't come up with the guidance document just to fill our word count, but it was stressed by several of the participants that they would require, or they need a guidance resource throughout the course of our interviews and our focus group discussions. There was a need to have an intelligible document with practical directives for various stakeholders, especially for young people and organizations involved in MHPSS responses. And one of the participants did mention, and I quote, I would like to see something which is not just a generic guidance, but something which is a little bit more prescriptive, with examples of how you can actually put this into practice. So a directive approach with practical suggestions and, you know, theoretical frameworks, it's all included in this guidance. And I encourage everyone to go back and read it, employ that within your organizations, within your communities, and at the very end, not just keep it as it is, go back to the youth, the leadership assessment scale, the YLAS. I'm sure you must have it in the chat, yes. And rate yourself, assess how you've been doing. We've got a a score of 0 to 64. Is it possible to have it on screen, Rachel?
Sure, the 𝘬𝘬, right? Sure.
Yeah. Awesome. All right. If you could just scroll all the way down, I could quickly take the participants to the grading. All right, thank you. So just a bit up. All right, so we've got the 0 to 21 over there. This just means, okay, you're getting started, you're building your foundation. You may not be completely having like a glow up, but you're just getting there. And 22 to 42. Sorry, I'm just going to. All right, you've made some progress, and there's still a lot of opportunity for you to keep improving with your with inclusion in young people in your responses. And the next category over there, 43 to 53, you're doing all right, but if you can refine the existing practices that you've got, explore innovative ways to empower young people. And the last category, 54 to 64, CEO of youth leadership, I would say. But I would encourage you to not just use this as an end to itself, but for continuous collaboration and improvement within your responses, and not just keep it as it is. Eric, if you
Yeah,
have...
thank you. I think there's just a few points to add to what you said. I think the skill is meant to guide organizations, not to be a final measure of success, because we also acknowledge that every organization is different. So the key is to use it as a tool to reflect on and to identify what you're doing right and what you are not doing right, and then to take remedial steps forward. And also to emphasize that the questions that are designed are comprehensive, but of course, you may also find that some questions are more relevant to you than others. So again, context is also very important. And the last point I want to make is that instead of worrying about the overall score, I think you should rather focus on specific areas that you need to improve. Because once you manage to identify your strengths and weaknesses, then it makes it easy for you to be able to create a more clear and effective action plans on the way forward. So with this, we want to thank you very much for your attention. And I want to yield back to Sharon. If Shruti, you don't have any much more thing to say.
Thank you, Eric. Thank you, everyone. Excited to hear from Isaac.
Yeah.
Yay, thank you so much, Eric and Shruti. It is such a meaningful discussion. But before we're moving on to our next agenda, I would like to remind everyone, if you have any questions, please feel free to put on the comment section and we'll get back to it until the end. Now I'm going to hand over to Victor.
Thanks so much, Sharon, and thank you, Eric and Shruti, for such a very detailed discussion on the research and the guidance documents. It is my pleasure now to introduce Dr. Isaac Olufadewa, who is the founder of the Slum and Rural Health Initiative Network. One of the network's flagship programs, that's called the Brave Heart Program, is a community-led mental health initiative that is operating in Nigeria, in the Durumi and New 𝘐𝘯𝘵 IDP camps. And they use a task-shifting approach to train influential community members to identify and manage common mental health disorders with evidence-based strategies. And these community members then step up to provide group-based mental health education and psychosocial support to young people experiencing symptoms of PTSD, anxiety, and depression. I'm very pleased to hear Dr. Isaac share some of the very practical experiences of youth leadership within the context of his very impactful work. Over to you, Isaac.
Yes, thank you very much, Victor. And then thank you so much for the invitation to speak today. Just as Dr. Victor has really introduced me, I'm Isaac Olufadewa. I work with a very unique, passionate group of people who are very very excited to really, conduct or work in the mental health space. So I would just basically be sharing my slide while I'm also like really focusing on like key points, especially like looking at today's topic, sharing about our Brave Heart Intervention project, which was done in like, the IDP camps, 2 IDP camps in northern part of Nigeria, Durumi and the new 𝘗𝘯𝘵 IDP camp in Nigeria. And like for Slum and Rural Health Initiative, as you can see me, I'm the one smiling with the red tie in the middle there. It's a 100% youth-led organization. Everyone is a young person. I'm the executive director. We have, people that are in charge of research, people in charge of different areas of the organization. And we've been basically working, especially in terms of like providing quality mental health, information and services in the world, most underserved regions, from urban slums or informal settlements to, internally displaced persons camps. To how to reach remote communities. And not only are we just youth-led, we're also youth-focused. So we're focused especially on like things that really bother with young people. And it's not a community that you have to be a doctor to really join. We have like IT experts, we have social scientists, we have researchers, just healthcare professionals from various fields of study. And I think that's really very important, because when we talk about like the value of youth-led and youth-led response to mental health, especially in like humanitarian setting, you need diverse stakeholders that are capable, to work together to achieve a common aim. And I think that's one good thing that we have been able to achieve. So aside from the core, maybe clinician perspective, you need someone that can really bring in, how do we leverage AI? How do we leverage the mobile apps? How do we leverage, community engagement that works? How do we leverage community drama? There were people from the arts, there were people from like various places that really connected with the work that we do. It did, the Brave Hearts projects, and we even had like a community drama, which is currently available on Google, on YouTube, called My Safe Place, which really talked about like, everywhere, why we need to, show compassion, why young people within this humanitarian setting need to be provided with, mental health services. And that's how this interdisciplinary nature of our work really comes in when we put in young people, because young people are creative, or young people understand other young people. Other young people can also connect with young people, and that has really
Dr. Isaac. I think that your slide hasn't worked yet. So do you mind checking it again?
Okay, are you seeing my slide now?
No, we can see your slide.
Okay.
We can only see the top, so maybe if you reshare. Sorry.
Okay.
Share
Yeah. So we really value the fact that like a lot of young people can.
Yep, that works now. Yeah. Thank you.
All right. Okay. So basically, that's like the picture of like staff from the organization, which we took some time ago, and then we have been really doing this. This is like a picture of like some of our beneficiaries or people that we serve, and some of the volunteers and staff that work with us in the internally displaced persons camp in northern Nigeria. We are not just youth, led. We focus on our attention on young people. And I feel that one of the biggest value when you involve young people is the creative nature of young people. Young people can really go above and beyond what they are asked to do. I will just give an example of our project where we also worked with people, with the displaced persons camps who contributed, who were part of like the drama group, who talked about like these issues around, depression, about PTSD, sharing their story courageously, and talking about these things. And it's currently available on YouTube right now. It's called My Safe Place. My Safe Place. And that is why we need to involve young people, because young people can best connect with other young people. Young people can best engage with other young people. It's just like, and then young people can also bring in their lived experiences, into the picture. Just to like really just give a background, just a very brief background here, 1 out of 10 people do not have access to mental health challenges in low and middle income countries like Nigeria and many other low and middle income countries. Over 3 million people in Nigeria are currently displaced. From 2022 till date. We've had like more than like 1.5 million people added because of flooding, climate change, and several other things. And from, not only just our research, but like what we saw is that like 3 out of 5 internally displaced persons have a one mild or or moderate or even severe mental health disorder. And there's a very high level of stigmatization, and there's lack of access to these things. And this is just like really just sharing. This one of our like people, researchers and advocates in the IDP camp, just really talking about these issues with one of the community members here, and you would see that on my screen, and it's really a very big issue. I've been to the IDP camp like more than like 100 times right now, and I think that as I'm sharing like the experience of the thing, we do community-led advocacy, task shifting, which means that we're training community members to be able to provide the solutions. So when Dr. Isaac is here giving the speech or giving a talk about what he's doing, work can still be going on, in the IDP camp. And it's a group. We use the gender non-combined approach, meaning that like female just for safeguarding and also to just ensure that it's most effective. Young women would, provide this support in terms of like being able to deliver cognitive behavioral therapy, especially focusing on problem solving to young people. We have the mobile app, which you can see also that the young community member is also like holding a tab. We give them the tab and then install the mobile app for them to use as a guidance and to just ensure fidelity, the approach with which they are delivering the sessions, with which they are also communicating and giving us feedback, from our perspective. And yes, we also like had the mental health policy, which we said they should declare a day in a month for them to like come together as a group to celebrate mental health, to talk to stories about their triumph, their challenges, to support one another. And that has really been going well so far. So just like an environmental day, we are also having that for them. And this is just the friendship tent over here, which we put in the 2 IDP camp. So the friendship tent is basically a mental health center where they can go to and get support. And you can see some graffiti over there. You are not alone, just to reinforce that message. And that's one of the things that we also got from our feedback, that anytime they see the friendship tent, they just really remember that they are not alone. They need to seek help and they need to seek support. And it was a constant reminder that mental health is real. So task shifting supports peer-to-peer mental health education, community sensitization on mental health and digital literacy training, for these people. And I would really just talk about, I've talked a lot about like the value. We've had challenges along the way, because I think when we talk about people that are marginalized, we have the marginalized within even the marginalized group. And I think women are, one of the key things. So when we call for like community member meetings, you'll find like it's 95% sometimes men, coming, attending those meetings. And sometimes we're sharing some, whether it's refreshment or some information, and we're like, where are the women? And, they're like, oh, they're inside the houses or they're inside the tent. And we're like, how to even do a special gender-based, advocacy and sensitization for them, for women to be able to participate as, members, and like, to be able to even talk and speak out within during our sessions. And we also had to really involve communicate with families, especially to involve their young girls in the project, in the program, because they don't believe that young girls should be pressing, like, be learning how to code, to be learning computer. And those were like really challenges that we didn't really envisage. Like, yeah, we didn't really know it's going to be that bad, until we got into the community and then really saw that, wow, even while you have a solution, sometimes you actually need more persuasion for some groups to actually really take up the solution. Lessons learned, I would say that strong engagement of government stakeholders from conceptualization to the beginning of project to the end of the project, and even the beginning of the project to the end of the project, and I think that's really important, because as non-profit workers, we usually really look at public scale up of our innovations or interventions. And I think most of the time we just really get into the middle of the project and we remember that, like, oh yes, let's communicate with this government stakeholder, let's communicate with that. In our own case, yes, we did communicate with them, but it wasn't really strong, like we should have brought them to the side, as they were constructing that. We should engage more strongly with them. And I think that's one key thing that, one advice that we to give to those that like having this, making these interventions and like just doing this project, especially like in humanitarian settings. It's very important, and it's because government is also doing some other work, and then you have to tell them that mental health is also a priority, which they can integrate into their existing work that they're doing. Second, I would say, is integrated solutions work. If you go to a humanitarian setting and then you're just taking only mental health to them, it might be hard for them to uptake your solution. And that's one thing I'm really excited about this project. One thing that gave me a lot of excitement was the fact that we already engaged with the community members even before we started the project. So they said, oh, if you have a project, we want you to be able to give us a project that can upskill our young people, that can give them the skills which they need, that they would need to work, that they can use, throughout their life, not just we bring in a health program to them. So when we told them that we wanted to work on a mental health project, we definitely included digital skills training for young people, which we have the computers and the laptops in the friendship tent, which is very secure. And that way we have community members gaining digital skills and digital lessons within the IDP camp. And some of them have even started working for organizations because of the project. There's really nothing that really improves mental health apart from the clinical stuff than money, right? So that's a very good thing that we see here. So because unemployment is also a cause for mental health, could also complicate many of these issues here and even make them even much more vulnerable to many things. So integrated solutions work, and that's one really key things as we really progress along the journey. And definitely create incentive models for community members. Don't just believe that they are free work, they are free sources of labor. A lot of organizations make that mistake. We gave the community members who are leading the intervention the mobile tablet. We put in some, gave them the cost for their focus group discussion, the cost of their transport, the cost of their feeding, and many of those things. It's very important. And I think that we need to incorporate these things because we want them to even take up the project even after we have left. And that's what we also saw. Now they are even using the tabs and using the mobile app, the Simbi Health mobile app, to deliver this intervention. And that's what makes our work. I think to the policymakers, to people in government, to funders, I know some of you are here. I want to say that young people are capable. See them as partners. And I feel that what really made even many of people in my organization and even myself where I am today is because some people invested in us. We've led projects over north of $200,000, and that means a whole lot in terms of being able to deliver projects. And we have really made a good we've really provided good value for the money, which you will see very soon. Co-creation and community engagement is different from participation, and that's for youth advocates, right? For community engagement, it's a two-way street. We don't just talk about you going to deliver lectures or conduct workshop. You actually have listening sessions with community members. When we went to the IDP camp for the first time, they said, no, there's nothing like mental health issues in their camp. Oh, but we didn't say no. There was nothing oh, no, we didn't argue with them. We're just really listening. Okay. Then we asked them, oh, do we have anybody that is maybe screaming at night? And they were like, yeah, we do have 5, 6, 7, and then it's just a process of having this dialogue, having this listening, ensuring that you are hearing from their perspective, not blaming or criticizing them, but also understanding where they're coming from. So participation is just basically it's a one-way street where you just really go in there, oh, come and participate in this program. And that shouldn't mean so. Engaging them means setting up things like community advisory board, youth lived experience group, talking to the community leaders about how is the program going? How are researchers doing the work they're supposed to do? What do they think about the program? Are their children learning well? Because when you have issues or challenges, you go and meet them. So community engagement is key, and it's a two-way street. So just to showcase some of the successes from our project, this article was the first study that we published on the project. It was published in 2022 in an Elsevier PubMed Index Journal of Migration, and we can see there young people expressing some of the mental health challenges that they have, and it has been cited 16 times. I just checked today and I was like, wow, that's interesting. And yeah, apart from that, we've also published like a couple of other works. Friendship Tent is a solar powered center, so it doesn't really depend on electricity. It's still serving them to date since we installed it in 2021, and that's like really good value for money. This talking about the impact of the project, and you can see, so we basically impact of the Brave Hearts Mental Health Project. This was published this year and has already been cited 4 times. Also we see other like mental health challenges that we have been able to like really highlight on the project. So selected achievements, we've been able to present our work, about 13 research and abstract publication on this project, more than 18 media features on this project already, 8+ conferences that this work has been showcased across like 4 continents of the world. We have a mobile application called the Symbiote mobile application, which we are now even really looking forward to even using more AI and like integrating those kind of like new approaches to this, especially as we are scaling now the Brave Hearts work not just in Nigeria but also in other countries in Africa. We also have like 2 friendship tents, and then 1 short movie has been produced entitled My Safe Place. It's currently on YouTube too. The friendship tent is also for the vocational skills training. So apart from like the group interpersonal sessions going on there, we also have all this. So these are some of our funders, biggest partners so far, Grand Challenges Canada. They have been really, really supportive of our work, also connecting us to, resources. And I think when we talk about funders and partners, it's much more than the money. It's also like the exposure and other things that it also brings to the fore. Yeah, so there's really no health without mental health. And I think people here are the biggest advocates for mental health. I would say let's keep supporting mental health, let's keep doing the work, and let's keep ensuring that young people are the one leading this work, especially because more than, we know that like a lot, 75% of mental health issues occur before the age of 24 years, and we are the best to lead this work for young people. So we have the power and we just need to use that. Thank you.
Amazing. Thanks so much, Isaac. I think this was very, very, I would say, detailed presentation of the work from how it came about to some of the impact that it's had. And I think it's a very good example of how integrating youth leadership in MHPSS responses can be very impactful. I will hand over back to Sharon to close us out. Over to you, Sharon.
All right, thank you so much, Victor, and thank you so much once again to Isaac. It is such a meaningful presentation, and I would love to say thank you to all the participants for coming to our webinar today. It is truly an honor for us, and I'm going to hand over again to Victor.
Okay, so I think we've already shared a link to the website where we can find all the resources. I think we've shared that again. If you have any questions, you have any feedback, you can always send us an email. Each resource has an email contact that you can reach out to if there's any questions that you have. And I think these resources are also free to use and share within your own networks as much as you can. After this webinar, we're going to be sharing the recording from it on our website as well, and across our LinkedIn and I think Twitter pages. But it's been a pleasure having you all here. Thank you so much. And Sharon, thank you so much for facilitating such an amazing session. Yeah, have a good rest of the day, everyone.